Hi, everyone. Welcome back. Today, we're joined again by Dr. Eddie Stenehjem to give our community update on COVID-19 in the state of Utah and around the country to see what's been going on. Eddie, as always, thank you so much for joining us. We really appreciate it.
Thanks for having me.
Hope you had a great week off last week and got some good relaxation in. It was nice to switch it up a little bit talking to Brandon Webb, but we have you back again today. As always, I want to talk about case counts first and trends. The state of Utah has a total of 74,050 cases. Yesterday's daily case count was 1,008. Our positive 7-day rolling average rate is around 13%. We have a total of 459 deaths in the state, and our hospitalizations reached 3,882 total throughout this entire pandemic. Eddie, as always, let's break down those numbers a little bit. How are we doing from a hospital standpoint, and are we still seeing this massive increase that we were a couple weeks ago?
Yeah, I mean, we're not doing great. Utah right now is the fourth highest state in the U.S. in terms of cases per population. Behind North Dakota, South Dakota, and Wisconsin, Utah is fourth. And so when we look at kind of the patterns that are happening here in Utah, we're struggling, and we're struggling along with other states that are struggling. And I think what you're seeing is that this virus causes very regional outbreaks that affect the U.S. differently, and likely is impacted by the different policies put in place at the state level and also at city level, whether it be, school policies or masking policies, et cetera. And right now, Utah is in a really big surge, and we're feeling it through our healthcare network. So, just looking at case counts, we've seen our case counts really go up in the past 2 weeks, and, we've seen them kind of stabilize. But let's keep in mind, they're stabilizing at a case count of about 1,000 per day. So yes, they stabilized. That's good. They're not continuing to go up and past that 1,400 case per day mark, which is good. But we haven't seen them come down yet. And so, you ask, what does that mean from a hospitalization standpoint? Well, we talked 2 weeks ago that approximately 10 days after you start seeing a rise in case counts, you start seeing an increase in hospitalizations. And that's exactly what we're seeing. And so when you look at our hospitalization numbers kind of at our low point, we really hit a high point in terms of hospitalizations late July and August. That came down, hit a low point in September. Now we're about 80% increased from that low point as of today. So we are now back up at a hospitalization census across Intermountain Healthcare is the same as we were back in late July and August. And so our hospitals are getting full. Intermountain Medical Center here is very full. And it's not just the COVID patients. We have a lot of those in the hospital, and both in the ICU and on our regular wards, but we're full of other patients. We're full of patients that have had traumas or heart attacks or strokes or bad pneumonias that are from other things and caused by COVID-19. And so, we're full, and we're now kind of moving patients around, making sure we optimize our capacity at all of our facilities. And we're really feeling the crunch right now. And we anticipate that, this is going to continue for us in our hospitals, not only just Intermountain, but across the state for at least another couple of weeks. And that's assuming that cases start coming down. That hospitalization is a lagging measure. And so that's going to continue to either increase or remain high for the next couple of weeks. And unfortunately, deaths will follow. We have always talked about that. First comes cases, then comes hospitalizations, then comes deaths. And we haven't seen the deaths increase, but they will, just because it follows the kind of natural course of this. And so we're hurting, we're struggling. Our caregivers are tired, they're disheartened, and we're going to keep going. And we just really hope that we can start kind of changing this epidemiology. And, the case counts have remained high throughout Utah, but if you look at cases per 100,000 population, Utah County is really the heart of this right now, with double the, incidence cases than compared to Salt Lake County. And what we're now seeing is that the cases in the young adults, kind of the 15 to 24-year-old, is kind of declining a bit. And now we're starting to see that increase in the other age groups, which is most likely due to, primary infection in the 15 to 24-year-olds now spreading to parents, grandparents, households, and those are the people that are getting sick and coming into the hospital.
You mentioned too, and which I think is really important, that our ICUs are not just only full of COVID-19 patients, but we have other patients in our hospitals, which I feel like is something not a lot of people think about. We hear these numbers about our ICU beds being full, and things didn't just stop just because of this pandemic. There's heart attacks, strokes, and everything else that happened. So I think it's important to think about the fact that, yes, maybe not everyone in the ICU is a COVID patient, but it still impacts our healthcare care that we give people. You mentioned a lot of the times that it's not the beds, it's the people, and that our caregivers are getting tired. And it's been 10 months of this almost, which is crazy. So it'll be interesting to see what happens as we get into this winter season. You mentioned, sorry, go ahead.
Keep in mind, back in March and April, we shut down surgeries, right? We shut down elective surgeries, which then opened up all this space in our hospital to allow for patients with COVID-19. Right now, we're continuing to do operations. We're continuing to do, elective heart valve surgeries, hip replacements. Those people need hospital beds after they get their operation. And so, we want to be able to keep those services going because those are essential services to the patients that need them. But those are things that we have to think about, if we don't get control over this pandemic. And I'm sure we'll see that not only happening in the state of Utah or those people thinking about that, but also across, the US where we're seeing surges.
I didn't know that we were the fourth highest or in that top four of states for cases. That's pretty alarming, especially with our population. We're not a dense population in the state of Utah, so it's interesting. You mentioned Utah County briefly too. Yesterday, one of our doctors was involved in the press conference with the governor. He was talking about the cases in Utah County and the importance of getting these down. Do you have any thoughts on anything that he mentioned or any advice for Utah County going forward?
No, I think Dr. Bishop did a great job. And what I really liked what he did is, he really brought in the patient voice and the caregiver voice into this discussion. He talks about, taking care of patients in the ICU. The patients are alone because they can't have visitors due to their COVID-19 infection. They talk about, seeing patients writing goodbye letters to loved ones because they can't see them. And it's really hard to communicate with loved ones in those rooms because of the fans and the noise and being on a ventilator. It just really is tragic watching people suffer in the ICU and on the floor with this disease. And I really like that he brought in, that context, that voice of, what it really looks like and feels like to be in these ICUs. And he really, emphasizes he wishes that, Utah County, and not just Utah County, all of us just can get on the same page about this virus. This isn't a political issue, that we know what works. We know that social distancing works. We know that masking works. This isn't up for debate at this point. And he just, urges our communities to really have this being a unifying point for us and something that we can rally behind. And, Utah has done this in the past. And so I really appreciated his comments and bringing that perspective to the conversation.
It's very sobering to hear from that perspective too, of what you just said, a patient writing a goodbye letter to someone. I feel like it's really important for people who are not still 100% on board with this idea of COVID to really look at that and say, okay, if my loved one was in a hospital, how would I feel about not being able to go say goodbye to them? Because that is the truth of what's happening, which is really unfortunate. So yeah, hopefully things start to shift a little bit, especially as we go into this colder season. We never know what will happen with flu. So it'll be really interesting in the next couple of weeks. I know a lot of schools have been closing or going to this 2-week quarantine period too, to kind of get their case counts under control. So lots of things could shift in the next couple of weeks. And along those lines, we all woke up this morning to a lot of notable figures coming out with COVID positive tests. What are your thoughts on kind of everything that's been happening, and what can we learn from these people that are coming out and talking about being positive, from risk factors to kind of this this incubation period of that 5 to 7 days?
Yeah, a lot to break down here. So, President Trump, the First Lady, and now Mike Lee, a Utah senator, just announced 20 minutes ago on Twitter that he too is positive. Lots of clearly notable public figures, and we clearly wish them well and hope for a speedy recovery. Things to think about when I kind of hear these things. Keep in mind, there's lots of people that have asymptomatic disease. Okay, and so we've seen this in older people, and we've definitely seen this in younger people, and we've seen this all the time because people are coming in and getting screened for COVID prior to procedures, and we're picking up, of those asymptomatic people we do, 3 to 5% are positive. And so we know that there are plenty of people out there with asymptomatic disease that do just fine. And we really hope that, that truly is going to be the case for, our president, the First Lady, Hope Hicks, and Mike Lee, and all the public officials. And who knows after that gets it, that these are just completely asymptomatic disease, and they run their course and they do fine. What we look at, once somebody gets diagnosed with infection, they're no longer quarantining. They now go into a period of what's called self-isolation. And so quarantine is for people that have been exposed and not yet infected. That is a 14-day period from the date of last exposure. That's what your quarantine period, and you're waiting for symptoms to start. Once you get diagnosed with COVID-19 or your symptoms start and you're waiting on your test result, you go into a period of self-isolation. Self-isolation means I'm infected and I want to prevent transmission to anybody else. And so you're going to really try to isolate yourself to prevent any transmission at all. Most cases, that self-isolation period lasts 10 days based on CDC criteria. So it's from the date of symptom onset, you have a 10-day period where you're considered to be infectious. At the end of 10 days, as long as your symptoms are improved, you've been afebrile, that is the point where you can come out of self-isolation. Now that changes a little bit depending on the severity of your disease. If you have severe disease or you're severely immunocompromised, then your period of self-isolation is actually 20 days. And so most people that are admitted to the hospital that have low oxygen saturations or abnormal hemodynamics, pulse, things like that, those people are getting a 20-day self-isolation period because we know that they can be infectious longer. And so we'll just have to wait and see in terms of our public officials, in terms of how they do. Things that I worry about in terms of our leaders is that a lot of our leaders, both in the state of Utah and also, at the national level, are over the age 65. Being over 65 is, one of the biggest risk factors of developing severe disease. Can somebody over 65 still have asymptomatic disease? Yes, absolutely. They sure can. But we also know that those are the people that are at the highest risk. And so when you look at all of our deaths in the US, 80% of our deaths are in people over the age of 65. So it just kind of tells you the severity that could be the case, in this disease. And so we're going to watch really carefully and, obviously afford people the best healthcare that they can have with this disease, whether you're, national leader or not. So our hopes are with everybody, and we'll see how this all plays out.
You mentioned asymptomatic cases, and I kind of want to bring up a question that someone asked us last time that we didn't get to. They wanted to know if we had any research yet or any information about them protecting a spouse or a loved one who's high risk that they live with, if they still have to leave the house and go other places. Is there a chance for the person who has to leave the house to potentially spread the virus to the high risk individual? And how are they supposed to really figure out if they're asymptomatic to kind of litigate that risk of spreading the disease to them?
Yeah, it's a really hard scenario. So the scenario you're posing, let's just put some more details. Let's say you have a very high risk person, somebody who's getting chemotherapy for cancer. Though that person is at home, they're not working, but they're really high risk because they're immunosuppressed from the chemotherapy. Maybe they're over the age 65, but they have a partner who needs to continue working, and they have to go out of the house, and maybe they're a school teacher, maybe they just work in retail, whatever it might be. How do you protect that person at home when the other spouse has to kind of go out and about and make a living and make sure they have insurance and those types of things? So things to think about in that instance. One is absolutely 100% wearing masks when that person that has to engage with the community is out and about. That is a absolute no-brainer. That needs to happen 100% of the time when they leave. We know that mask use is preventing spread of the virus out into the community, and also is going to have a protective benefit for the person wearing it. And there's some data actually to show that if you wear a mask, you'll have less severe disease. So one is mask use, one is vigilant hand hygiene, and then the other is, when that person is out and about in the community, to really focus on social distancing. So if you still have to go to work, how do you make sure that there's at least 6 feet of distance between you and anybody else, and really avoiding any kind of large crowds or gathering. Besides that, there is, a growing number of people that will actually recommend wearing masks in the house. And, that's something that's new and relatively extreme, but in somebody who's truly high risk, that may be something you would actually consider, is to wear a mask in the house to prevent exactly what you said, that person getting asymptomatically infected, not knowing it, and then spreading it to their spouse. And that's something to consider. I think it's easier said than done. And you have to be thinking that you'd be wearing a mask in the house for quite some time, considering this pandemic isn't going anywhere. But that's something to think about. I mean, ideally, what we'll get to eventually, once rapid at-home testing is available, is that person that's at risk would do a test, every day, every other day, to identify that they're still negative, or identify when they turn positive. I mean, that actually is probably, in our future, but it's probably a little ways away just from a test availability standpoint, but that really would be the way to do it.
I know we've talked about that too from a school standpoint, and the fact that could be a future where everyone is back in school, and we have that ability to rapid test students and teachers before they come in, and that could be something of the future. I know that there's some places that are doing that right now, or some states that have easier access to rapid testing. So that'll be interesting to see what happens. But it's good advice about wearing a mask. I think, like you said, it's kind of this personal decision too on whether you want to wear a mask 24/7, basically. And if you have to make that decision, very personal. I want to talk a little bit about the importance of quarantining and self-isolating while you're waiting for results, and kind of which one you are realistically doing. We've had a lot of scenarios where high school students are waiting for results to come back before they can go back to school. And there's this period where you might have a couple of days where you haven't gotten the results yet, but people are itching to leave and to go out. Why is it so important, though, for people to stay home until they find out their results?
Yeah, so let's kind of clarify a little bit of that. There's people that develop symptoms, go out and get tested, and then are waiting for their test results. And so that person is what we call a person under investigation, meaning they have symptoms that could be consistent with coronavirus. And they went and got a test, and now they're waiting to see if their symptoms that they have is due to SARS-CoV-2, the virus that causes is coronavirus. 100%, you got to stay home as you're waiting for those test results. You may very well have coronavirus, and the last thing you want to do is spread that more to your family, to your community, to your friends, to your social network group. It's just a no-brainer. And quite frankly, regardless if you have coronavirus or not, regardless if that test is positive, as long as you have symptoms of a respiratory tract infection, you need to stay home. The last thing we want right now is to have more transmission of other respiratory viruses that cause the common cold, human metapneumoviruses, rhinoviruses, other seasonal coronaviruses. We really need to stop the spread of those as well, to allow us to have a better sense of the epidemiology of SARS-CoV-2 or coronavirus. And so if you have symptoms, you got to wait for that test result, and you really need to wait until your symptoms are gone and you have a negative test result before you can engage with the community, because we certainly don't want any spread of other viruses in the community at this time right now. Now, in quarantine, so somebody, let's say, goes out and they've been exposed to somebody. They don't have symptoms, but they've been notified by the health department that they are at a high risk. And so then they enter a period of quarantine. That quarantine period is 14 days. And it's 14 days because that is the incubation period of the virus. Most people, if they get exposed, will develop signs and symptoms within 5 to 7 days. Okay, but the health department's going to say, stay home for 14 days. The health department may go out and actually test you to determine whether or not you are acutely infected asymptomatically, but that doesn't change your quarantine period. Okay, so if they go out and test you and you're negative at day 3, you could turn positive at day 5, 6, or 7. So you got to stay home. There's talk both at the national level and likely at the state level about, can you test out of quarantine? So you get exposed and now you go 7 days of quarantine. And if you have a negative test at 7 days, could you potentially come out of quarantine? Because you've really passed that high risk period. And if you're negative at 7 days, maybe you can get out. And so there's talk about that nationally. That has not been a policy that has been brought on anywhere locally that we know of. But that is something that is being talked about, because ideally, if you can do that, if you have the test capacity, then you can half your quarantine time. So then kids get back to school, people get back to work. That'd be great. But that's something that is just starting to be really talked about and looked at, and it's not quite there yet. So I think it's really important for us to know, if you've been exposed and if you get tested, let's say you get tested day 3 after exposure, that does not mean you can leave quarantine, okay? Because you very well could have asymptomatically have the virus in your nose at day 4, day 5, and symptoms start at day 6 and 7, and now you're spreading the virus, and that negative test at day 3 meant nothing.
You mentioned alleviating all of the potential other respiratory issues that are happening and why it's so important to stay home if you have symptoms. Flu season is starting, and Intermountain just started its flu shot clinics, flu vaccine clinics this past week. Why is it so important this year, especially to get a flu vaccine and to protect yourself from a potential influenza?
Yeah, so October really starts the month of flu vaccines. That's when we traditionally start vaccinating people, and Intermountain has just started, and you see vaccines available throughout the community, and now's a great time to get vaccinated. We know that getting vaccinated for flu decreases the chance of developing severe disease from influenza. Severe disease from influenza causes a lot of hospitalizations in the winter months, especially among the elderly and immunocompromised. We have a method to prevent that. That's the flu vaccine. And so we need to make sure we do everything we can to get people vaccinated, so that decreases the amount of severe flu that we see and have to take care of in our hospitals, knowing that we're likely going to be having to take care of lots of patients with COVID-19. And so it's really our time to say, okay, what can we do to, decrease the burden on the healthcare system? Get a flu shot, in addition to socialize, distancing and wearing a mask and hand hygiene. Flu shot's incredibly important this time of year. It's hard for us to predict what flu is going to look like this year. Usually we can have a pretty good sense of what's going to happen based on the Southern Hemisphere, but the Southern Hemisphere had a really attenuated flu season because of all the things we mentioned. They had pretty strict, social distancing criteria, people wearing masks, and lots of flu vaccines. So we hope that we have that same experience in the Northern Hemisphere starting this fall. But we just have no idea. We've never experienced anything like this before. So what we know you can do is go get a flu shot and get it wherever you can, whether it be at a pharmacy or an Intermountain drive-up clinic, whatever it might be. Just get your flu shot.
And you can also get your flu shot at your annual scheduled appointments too, which I think is important. If you have something scheduled the next couple of weeks, just ask your provider for that. Or if you're going with your child to an appointment, a pediatric appointment, you can also get your flu shot at the same time as theirs, which I think is really great. Along the same lines of vaccines, there's been a couple of talks about vaccines coming out for COVID-19. Pfizer talked about potentially having something by the end of October that they find out if it's effective. And there's been other studies that is not going to be available until the end of March. What are the pros and cons of releasing a vaccine now versus waiting a few months to see kind of what happens with the testing and the trials?
Yeah, man, this is a hot topic right now. Yeah, Pfizer has said maybe by the end of October they're going to have data on efficacy. And then Moderna came out and said we're not going to have a vaccine ready until the end of March. Haven't really heard from AstraZeneca. Johnson & Johnson just started their trial not too long ago, trying to get 60,000 people enrolled in the Johnson & Johnson trial, multiple different vaccine platforms and candidates. So really a very active area of vaccine research right now. We have not seen any data yet on any of the phase 3 trials in terms of efficacy. And so it's going to be a significant balance of when to release these vaccines. And, I think vaccines should be released once the research has deemed them effective and safe, and that the FDA has approved it through emergency use authorization, and that we can effectively communicate about the vaccine in terms of who should get it and what to expect. I worry that if this process gets rushed and we have a vaccine that comes to market before we really have a good sense of the safety profile, I worry that it has the potential to have negative downstream consequences as it relates to vaccine hesitancy. We know from data that's been done through polling that only about 50% of the US population would be willing to get the coronavirus vaccine. That's not enough for us to generate, quote unquote, herd immunity or community protection. And so we really need to do our due diligence to make sure we, as in the medical community, to make sure that these vaccines are safe for people. And I worry that just 2 to 3 months of time watching the effect of this vaccine is not enough. And so there has been some push against Pfizer to say you need a little more time than just 3 months of data to really determine how safe and how effective these vaccines are. And so it's that delicate balance. Do you bring a vaccine early with the hope of preventing ongoing transmission, which then prevents severe disease and death? But bringing it too early could have missed side effects that we won't see until it's distributed in the community and develop side effects that might be severe. So it's a balance, and I'm hoping that we'll have more and more data really coming out December, January, which gives us 6 months of time to see how effective some of these early vaccines are, with then distribution occurring March and April. And then working with obviously state and national leaders in terms of who should be prioritized for the vaccine, because we're not going to have enough vaccines to vaccinate everybody that needs it, and so we're going to have to do a staged kind of rollout. And so here I think this is really important for patients, and just making sure we do our due diligence that this is a safe and effective vaccine.
Yeah, it'll be interesting to see what happens the next couple of months with the vaccine, and as we learn more about Pfizer's study, and just if they really do feel confident. You said that 50% of the population only feels confident taking that vaccine, which is interesting. It'll be interesting to see if that changes if the vaccine's released at the end of October versus next year sometime. It's all kind of just a waiting game to see what happens. So, Eddie, is there anything else that you wanted to mention to us this week about what's been happening with COVID-19?
No, again, I think Utah is at an inflection point right now. We really need to band together and decrease our case counts. I really am nervous about the winter. We're having rising case counts at a time where it's the nicest weather it's ever been in Utah. I mean, it's beautiful. We can be outside. We can enjoy, company outside. As we move into November and December, as we move into the holiday season where it gets cold and now people are moving indoors, I really worry about that time of year, and how are we going to mitigate cases as everybody's moving indoors, and as people want to have holiday parties and want to have get-togethers. That's going to be a really tough time, for us in terms of preventing the spread. And so in order to prepare for that, we really got to get cases down, and we have to really be thinking ahead. what are we going to do for this winter? And, that's something me and my family has been, thinking about a lot. And, how can we, be outdoors and have social interactions with our friends? We just bought an outdoor heat lamp because, well, we hope we did. It's on back order from Amazon. So we'll see if it shows up in time. But we think, that is a way for us to be outside and be able to enjoy, company and, but be safe. And so I would really urge us all to be thinking about this. How are you going to do holidays, Thanksgiving, Christmas? What's that going to look like? It's going to be different this year. This is not going to go away by November. By the time Thanksgiving and Christmas come, it's going to change the way we celebrate our holidays. And I think we should be thinking about that now and talking about that with our families and with our friends to not be surprised by it. And so I think we really need to come together, decrease our case counts. I'm hoping to see some unity in Utah County and decreasing the number of cases they've seen there. And so we have a better spot to go into the holiday season. So I guess those are my thoughts, Amanda.
I am also buying a heat lamp. I think it's a great idea if you have the ability to gather outdoors. There's lots of heat lamps for sale right now, so look into that. But Eddie, thank you so much for your sound advice this week. We really appreciate the update. And if you guys have any questions about COVID-19, you can call our COVID-19 hotline at 844-442-5224. We do know there is a high volume of calls coming in right now, so please be patient as we get to people making those phone calls. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Eddie, thanks again, and we'll chat with you next week.
Thanks, Amanda.